Eczema is the most common inflammatory skin condition. It can appear at any age, but it's far more common in children. Children can start getting eczema when they are very small babies, but it can also present in young adults, and even in the elderly. We have patients coming into clinic covered with eczema. It can be avoided, and we don't really know why people get eczema so frequently. It shows on the skin like red, scaly, itchy patches, and it can be very localized on in children, normally on creases on the limbs, on the arms and legs, but it can be widespread, covering the whole body surface and the face. It can be avoided, and if you have family background or relatives that have asthma, food allergies, eczema, or hay fever, you probably have more chance of getting eczema yourself. It can really be avoided. There's a lot of studies trying different things in pregnant mothers to try to stop children getting eczema, but nothing has been successful. They try vitamin D and probiotics and all sorts of things, but nothing has been really effective preventing eczema. Well, as I said before, patients that have family background of asthma, hay fever, and eczema, with relatives in the family, with close relatives in the family with these conditions, may have more risk of developing eczema. Children with eczema, 80% of children with eczema tend to get better, and the eczema may go away. Although we see people later on in life that had eczema as children, they come to clinic with eczema later on in life. We have cases with very severe eczema that can be lifelong. People can just live with eczema all their lives. And life-threatening, not really. Well, if you get a very neglected eczema, you don't apply any treatments, you can get an infection, and an infection can lead to sepsis. But I've never seen really anyone dying because of eczema. But it's not impossible to think you can get a bad infection and die of sepsis. No, sadly, we can cure eczema. There are treatments, and the treatments sometimes can be more effective. And we are getting new treatments, but there is no cure for eczema so far, unfortunately. And the treatments are we're still getting new treatments, like developing better treatments. No, the surgery is not a treatment option for eczema. Unfortunately, there's no way we can operate patients with eczema. The treatments are normally creams, emollients. The patients with eczema tend to have very dry skin, so emollients and moisturizers are very important. We recommend patients to avoid using perfumes, fragrances, preservative things that can dry the skin and make the eczema worse. Topical steroids are a very important tool to treat eczema. I know people are very wary about using topical steroids, but well used, they are perfectly safe. We now have something called calcineurin inhibitors, which are also eczema treatments, and they are steroid-free treatments. And then when the eczema is very severe, patients need to take systemic treatments, namely immunosuppressants like methotrexate or azathioprine or cyclosporine. And nowadays we have JAK inhibitors and biologics for eczema, and that's all very exciting to know we're going to get better treatments in the near future.